Here again, this will be the spinal cord. It's starting from the foramen magnum, and it runs all the way up to L1. And this is the whole length of the spinal cord. But after it stops here, it continues also as it's called cauda equina. This part here, this cone-shaped area where it stops, this is called the medullary cone. And from here onwards, you can see it's like a horse's tail. Cauda equina means horse's tail. So this is the cauda equina. The spinal cord ends here, but the nerves continue. And you can see in the middle, there's a little connection between the conus medullaris, which is the cone, and the coccyx here. This little piece of tissue or strip of tissue, this is called the filum terminale. And the filum terminale is actually the pia mater. Pia mater is one of the layers of the brain, and the pia mater comes and it condenses into the filum terminale, and this is what stabilizes your spinal cord. So your spinal cord will not be flapping. Okay, so over here, I want you to know two important nerves, which is coming from one is coming from the lumbar plexus. So the lumbar plexus comes here, and they form all these plexus. I told you there is a little web of nerves, and from there the nerves start. So from the lumbar plexus comes the femoral nerve. The femoral nerve is very, very important. This is one of the main nerves of the body, the femoral nerve. It supplies the thigh muscles. And from the sacral area, this is the sacral area, and from the sacral area, you can see a nerve coming out. This is called the sciatic nerve. You might have heard about sciatica. Yeah, sciatica is when you have shooting pain extending from the lower back up to the lower part of the leg. So it's a shooting pain going through the back. So that is due to the compression of the sciatic nerve. Most commonly, it is due to compression at the level of the intervertebral disc. The intervertebral disc will compress on the nerve, and it causes pain, and that is the shooting pain when you experience, and that's called sciatica. So this is a sciatic nerve. This is a femoral nerve, and over here you can see this is a cervical area. This is the brachial plexus. These are the plexus which supplies the arm. I explained to you about the axillary nerve, and we'll see that in the next model. So over here you have the axillary nerve, you have the radial nerve, ulnar nerve, and median nerve. These are the nerve that supplies the upper limb. And one more thing which I want you to know here, you can see there's a chain of over here, which is parallel to the spinal cord. This is called the cervical ganglia. So the parasympathetic, the sympathetic ganglia. So this is the ganglia which is involved in the fight or flight response. So this is a sympathetic ganglia. And so there are plexus in the cervical area, plexus in the lumbar area, in the sacral area, and the coccygeal area. From the coccygeal area, there's a nerve coming, which is a coccygeal nerve. But there's no plexus here in the thoracic region. So this area here, there's no plexus, and there is actually the thoracic nerve comes out, and it doesn't form a plexus like the other regions. It comes out and it supplies the intercostal muscles. Okay, so that's the, okay.